The most dangerous sign of type 2 diabetes is not frequent urination. It's not a sudden increase in thirst. In fact, diabetics don't feel any symptoms for at least 15 to 20 years before they develop diabetes.
All right, let's hear it.
One of the best indicators to predict diabetes is to do a fasting insulin test. Unfortunately, a lot of doctors don't ever test.
So that is wrong. That is actively bad advice from a grifter who's never medically managed diabetes in his life. As a family medicine physician, I manage diabetes all the time, so let's get into it. For those that don't know, it is absolutely normal for sugar to just be floating around in our blood. But diabetes is a super form of insulin resistance where there is too much sugar floating around in our blood, and that causes problems. And if you're thinking, wait, he said test insulin, doesn't that make sense? No, and I'll tell you why using this article. In most people with diabetes or even at risk for diabetes, testing insulin is not recommended. It's only really used for research, and that is because insulin in everybody is finicky. If you were to just grab even a fasting insulin, you will get vastly different results between the two. So the argument that it needs to be below a certain number is not really beneficial. The mainstay of how to diagnose diabetes is either with an A1C, a fasting plasma glucose, or with a 2-hour glucose tolerance test. None of these involve actually obtaining an insulin lab test. And that is because mostly for managing diabetes from a medical standpoint, it is more important to identify the consequences of insulin resistance rather than getting an insulin number that doesn't tell you a whole lot. Yes, there's more upcoming research showing that you can calculate someone's insulin resistance using someone's fasting insulin and their fasting sugar and putting it into a calculator called the HOMA-IR. But even then, his advice that says the most dangerous sign, of which he doesn't even say what it is, to get a fasting insulin level, to then breed distrust that most doctors don't get it because they actually know how to manage it. Talk to your medical provider, not this grifter. Don't get scammed. Take back your health.